goals in terms of healthcare during pregnancy for ewes and does? Well, obviously, we want them to complete their pregnancy and have a successful pregnancy. We want them to give birth to healthy and viable offspring. We don't want teeny little babies and we don't want giant babies. We want babies of moderate size. Now, that size depends on species. Lambs tend to be heavier than goats, and it depends on breeds. Obviously, a little Nigerian dwarf isn't going to weigh what a boar goat weighs. So a moderate size relative to the breed and to some degree even the nutritional plane of our animals. And once we have successful babies on the ground, obviously we want them to thrive and to grow well. And an awful lot of that has to do with her milk production. It has to do with other things too, you know, some of her mothering ability, obviously, but her milk production, both the first milk, colostrum, as well as her production throughout lactation. So what I'm going to start talking about is 3 diseases that we can encounter, mostly in late pregnancy, that are nutritional or metabolic in cause. I know that you're having a presentation on feeding pregnant females, but there is so much overlap between health and nutrition that I'll probably be covering a little bit of some of the same stuff because I really can't separate the two. So 3 of the primary problems or diseases that we encounter in a pregnant female is pregnancy toxemia, milk fever, and a vaginal prolapse. So let's look at each one of these individually. So the first one is pregnancy toxemia. It has lots of different names that you may sometimes hear. Ketosis. In fact, one of the products that you can use to treat pregnancy toxemia is called ketosis cure. In the sheep business, we often call it twin lamb disease because it's associated with females carrying multiple births. Lambing sickness because it occurs during parturition. It affects the liver. That's where the fatty liver syndrome name comes in. Basically, what pregnancy toxemia is it's a negative energy balance, low blood sugar, caused by an inadequate intake of energy during late gestation. Because the female's not getting enough nutrition, enough energy, enough glucose, she will start to mobilize body fat for energy. But the liver cannot break down all that fat and will end up producing what's called ketone bodies, and these can be toxic. There's many different risk factors for pregnancy toxemia, and I want to talk about that. And it's usually a flock or herd problem. It's not usually an individual problem. It's usually, and if it does happen to, say, one individual, you really need to look at the whole flock and your whole program to make sure it doesn't happen to others. So it's not an isolated thing. The symptoms of pregnancy toxemia are very similar to milk fever, which I'll talk about. They go off feed or just don't, they have a decreased appetite. They tend to lag behind. They may separate from the rest of the group. They may become lethargic. You may see nervous signs. They may be in pain, and one of the signs of pain in sheep and goats can be grinding their teeth. Eventually, they go down. They become recumbent. If they aren't successfully treated, they will die. So it's usually a progression of symptoms. If you see a female that's just a little off and she's in late pregnancy, my first thought is always pregnancy toxemia. It's definitely something you want to catch and see those subtle signs. And again, the subtle signs is she's not as aggressive at feeding. Maybe she's slower coming into the field. Maybe she's, again, isolating herself. You can catch those subtle signs, and most of the time it's pregnancy toxemia. That's the most common cause of those types of symptoms in late pregnancy. So, what are some of the risk factors for pregnancy toxemia? What causes it? Well, it can happen to any age or breed of sheep or goat. I think it's more common in sheep, maybe not, maybe. It occurs in late pregnancy. So, again, if you see those symptoms in mid pregnancy, it's not likely pregnancy toxemia. So, it occurs in late pregnancy. It occurs mostly when they're carrying multiple fetuses, twins, triplets, quadruplets, and that's a problem or a risk factor for multiple reasons. One, you've got more fetuses that are growing and putting demands on the female, and you also they're taking up more space in her body, which means she's got reduced rumen capacity, so she can't eat enough, particularly if it's not high quality. Being over and under conditioned are both problematic. Um, and of course, the main cause is what I've always said is she's receiving a diet that fails to meet her energy or TDN, total digestible nutrients, her requirements. You're not giving her enough. Now, you can give them enough, and for various reasons, they might not get enough. Like if you have a really old or timid female and she just always gets pushed around, it's possible you're offering her enough feed, but can't she can't meet her requirements. The other risk factor is feeding them very low quality hay or forage. I mean, theoretically, animals don't need a percent energy or a percent protein. They need pounds or kilograms or grams or ounces of something. So theoretically, if you have enough feed out there, if you had enough low quality hay, theoretically, if she'd eat enough, she'd get what she needs. But again, you're talking about a female that's got reduced rumen capacity. She probably isn't eating or foraging as aggressively, and she can't eat enough of a low quality feed. She could have other diseases or conditions that limit her feed intake. Let's say she has foot rot. She doesn't want to get up and go to the feed trough. So anything that's going to limit either her ability or desire to eat, you could still have a good feed ration out there, but if it limits her ability, she may not get enough. Breed and genetics may perhaps have, and I think a lot of the breed or genetics has to go back to the multiple births. We certainly have both breeds and individuals that are more prolific. And so obviously they are more prone to pregnancy toxemia. We also have, I'm going to say, breeds that are conditioned a little bit better, are easy keepers, so might get a little bit more over conditioned. And then stress. We often don't ever say stress causes particular problems or diseases, but it's sometimes it's a contributing factor, and it may be the last straw, the last thing that causes that disease to express itself. So how do you treat pregnancy toxemia if you think you have it? And you can test the urine, you can test blood, but like I said, anytime there's a female in late pregnancy, particularly one that you suspect is carrying multiples, there's a pretty good chance it's pregnancy toxemia. And so again, catching it early is key to success. At the beginning, you can individually pen females and give them access to more palatable or energy dense feeds. Poor quality hay is the exact opposite of an energy dense feed. At the other end of the pendulum is corn. So, and then everything in between. Okay. Relatively early on, you can give them various energy products that you can drench with and give it to them orally. Even if she's still eating and drinking, you could theoretically put molasses, apple vinegar in the water. The most recommended treatment for this early pregnancy toxemia is propylene glycol, frequently, again, called ketosis cure. But really, any source of molasses, or not molasses, of energy is going to help. As she gets further along in the progression of the disease or the symptoms, then we kind of move towards giving her injections, a subcutaneous or sub-Q injection of glucose, dextrose under the skin. And then when she gets much further advanced, then that glucose it needs to be given intravenously. And if you're not experienced doing that, you should certainly work with a vet and have them do that. Typically, because the symptoms are quite similar, we will simultaneously treat the animal for milk fever. In some cases, particularly if you have a due date, you can induce parturition, lambing or kidding. There are various drugs that will basically cause them to abort or for the offspring to be born. You can pretty much be certain that you're going to be providing assistance. I think the drugs that are typically used tend to be more effective in goats than in sheep. When you get fairly far along in the progression of symptoms, it may be necessary to do a C-section. Once those lambs and kids are out of her, that kind of solves the problem. And hopefully you haven't waited too long, and hopefully you get viable offspring and you're able to save the mama as well. And then, of course, there can be situations with almost any disease where it's simply gone too far, and the proper thing is to humanely euthanize that animal. So it all starts, it's a progression. So if you catch it early, the treatments are easier and they can be quite successful. The farther along you go, you're more likely to need veterinary assistance, which is going to substantially increase your costs. So what you'd rather do, obviously, is prevent pregnancy toxemia. So we know it's caused by inadequate intake of energy during late pregnancy. So obviously, the answer is to provide sufficient energy during late pregnancy. High quality forage, there are differences in the energy content of forages. A low quality hay could be less than 50% TDN. A high quality hay could be over 60%. In addition to those figures, which don't sound that far apart, it could have a big impact on palatability. She's more likely to eat that hay that's 60% TDN versus one that's 50%. There can be a substantial difference in quality. Most of the time, it's recommended that you feed some grain in late pregnancy, particularly if you have a high percentage of multiple births, and obviously, particularly if you're not feeding a high quality forage. You should separate your animals into production groups if necessary. And even if it's not necessary, I'm going to say if it's possible. If you scan them, obviously you would be able to separate them into production groups based on how many offspring they're carrying. If you don't scan them, you can at least separate the yearlings, the first timers. It's very important to balance rations to make sure pregnant females are getting pregnancy toxemia. Just throwing feed out there is no assurance. And you may be fine, free choice hay and a little bit of corn. You may be fine, and then 1 year it catches up with you because the quality of the hay is not so good, or for some other reason. So it's always good to know that you're actually meeting their requirements. It's important to have enough feeder space, particularly if you're limit feeding or hand feeding. There are recommendations on how much space they should have, and I would exceed that. If you have horned animals, you probably need more space. But just make sure those older ones or those more timid ones can get enough to eat. I already mentioned separating out the ewe lambs and the doelings. They should be fed and managed separately until they are bred or exposed for the second time. And ideally, you want to aim for a body condition score of 3 to 3.5 at the time of lambing or kidding. I'll say more towards 3 if you're pasture lambing and kidding, and probably more towards 3.5 if you're lambing and kidding in a barn and you're, feeding out of a bucket. Okay, milk fever. It's not a fever. It's actually low blood calcium, and it's caused by an inadequate intake of calcium in late gestation, or the inability to mobilize the calcium from the body, which can actually be caused by overfeeding of calcium in late gestation. Nutrition isn't about feeding more. It's about feeding the right amount, not too much and not too little, but actually meeting the requirements. Milk fever occurs more often before parturition, but it can also occur after. In dairy cows, and I think dairy goats, it often occurs after parturition. But more commonly, definitely in sheep, it occurs before and is generally caused by inadequate intake of calcium. Symptoms are very similar to pregnancy toxemia. And again, you usually end up treating for both. And one way you can tell the difference is how they respond to treatment. Because when you catch these things early, they respond very well to treatment. So what is treatment of milk fever? Well, it's essentially calcium. If you catch it early on, you can give it orally. Again, as the disease progresses, we go from giving products orally to subcutaneously onto the skin. And then when they're fairly far along, you give them in the IV, calcium in the IV. And one of the things you have to be really careful about when you're giving calcium in the IV is you have to be very slow and very cautious. If you've ever seen a female respond with milk fever respond to calcium, it's like it's a miracle. That's the way it looks, but you have to be very careful. And again, if you don't have experience giving IVs, you definitely want to work with your veterinarian to do that. One of the ways I look at working with vets is we both also learn. They learn more about, if they come to your farm, they learn more about the industry, they learn more about production practices. And sometimes you learn skills from them so that the next time you might need to do this, you might be able to do it on your own. But if you've never done things before, you certainly need to have a vet do it. So how do you prevent? Yes.
There are a couple of questions in the chat box.
There's 11 of them.
Can you use human ketone test unit for goats?
If it's testing for the same thing, you're looking for ketone bodies. I don't know enough about the human one, and I have to admit, as a producer, I've always just not worried about testing. I've always just gone ahead and given them propylene glycol, whenever they're off. I think with dairy goats, and I think that question was with dairy goats, where it's a little bit different in the sense that they're a much more highly managed and highly fed animal, and much more fragile's not the right word, but we're more particular about things. I don't specifically know if the human test kits would work. I don't know, but if they're looking for the same thing and the scale is similar, it just would depend.
Another question is, would toxemia show up on necropsy?
Pregnancy. So that's a good question. I never thought of that. I mean, I've never thought of, because I would think it would when you think what's happening metabolically. It would be logical to me. Can I say with exact certainty? I guess not. Pregnancy toxemia is usually pretty easily diagnosed when the animal's still living. But occasionally, I guess you could have a dead female full of babies and not know why she died and have a necropsy done. I would, but again, if I just found a dead animal with babies in it, it wouldn't be pregnancy toxemia, because you would see the symptoms. It just doesn't. Some health problems in sheep and goats can happen like overnight, right? We can lose them to barber pole worm that quickly. Pregnancy toxemia has a progression. It has a
another
progression.
question is, when should you start using ketone test strips before kidding?
Well, I mean, we look at it as a late pregnancy problem. So, whether the closer you get to pregnancy, the more sense it would make, a couple of weeks before.
Sure.
If that makes sense. But I guess I would, instead of testing, I would be put more of my thought process into, am I meeting their nutritional requirements? Because if I'm meeting their nutritional requirements and I know that and I'm not just throwing feed out there, I know specifically what they're consuming, that would probably be better. But to the question, I would say the last few weeks. No, probably no, 4 weeks, maybe test them,
Sure.
weekly. But don't I guess my thing is, don't set yourself up for, I'm going to have problems, so I'm going to test them. Make sure you're doing what you need to prevent it, which is nutritionally and you know,
Sure.
and one of the, and I think I talk about it later, but and that's why I say this topic overlaps so much with nutrition. I mean, these diseases are nutritional. They're
Mhm.
nutritional. So we need to test forages and balance rations. So,
Susan, I have the polls ready, so you can tell me if you want the polls by the end or you want during your presentation.
oh, you
Like,
mean the questions
yeah, the questions. Yeah.
at the end? At
Okay.
the end.
Okay.
Yeah.
Sure. Yeah.
Um, and somebody just mentioned about giving Tums. I know people who do that too. And I would still rather balance the ration. I would. And if my ration's inadequate with calcium, I'm gonna reformulate that ration so it includes calcium. But Tums is calcium. I understand that, and it'd be interesting to see how much it is. Do you know what I mean? Because again, they have requirements. The minerals requirements obviously are more like ounces and grams, whereas energy and protein are more like pounds and kilograms. So it's a much smaller amount. But if you just needed a little bit, I suppose that could make some sense. Red wine to treat ketosis. Oh, those lucky cattle. Um, if it's again, we're trying to get energy into them. We're trying to get glucose into them. If that's a source, I just can't imagine that red wine is. I guess it could be pretty crappy wine and be pretty cheap, but I think there would be much cheaper way. I could be wrong, but much cheaper ways to treat it. But anything that provides an energy source. If I was recommending, if I was telling you what you should give, I think you should give propylene glycol. I do. Are there other things where you don't happen to have on hand? You have one right now that needs treated and you don't have any of that on hand, or it's like 15 years old. Well, what else do you have in your house that you can use? Because a lot of times there are stuff in our house that we can use to provide some of these nutritional things, mostly nutritional, mostly things that affect the nutrition. So when we talk about calcium in the diet, we want enough, but again, we don't want to overfeed it because we can get milk fever overfeeding it. We can get it underfeeding it. The highest requirements for calcium for sheep is during late gestation. And again, that's why you mostly see uh, milk fever in late gestation, because that's when the requirements peak. For goats, the highest requirement is early lactation. In fact, if you look at the requirements, mid and late are not significantly different. So difference between the species. So we want to balance rations for calcium and phosphorus, not just protein and energy, but calcium and phosphorus. And we want to aim to have a calcium to phosphorus ratio of about 1.5 to 1. That's not quite as high as if we were feeding like wethers and males to prevent urinary calculi. There we recommend at least 2 to 1, but we do want more calcium than phosphorus. The other thing to keep in mind is if you put the minerals in as free choice, when you don't have enough in the diet. Let's say you're feeding a low quality hay and you're putting a little bit more energy in with them in corn. Well, that diet's going to be deficient in calcium. If you put that minerals out there free choice for them, probably a lot of them are going to get what they need, but some of them aren't. So you want to, when I say balance the ration, that means they're going to, for lack of better words, force feed it, for lack of better words. So we want to make sure they get enough. So don't always rely on free choice. And again, emphasizing stress can be a trigger of a lot of these diseases. Okay, the next one is vaginal prolapses. And you can see obviously from the picture, it's when the vagina is pushed outside the vulva. This occurs in late pregnancy, the last few weeks. The earlier it occurs, probably the more problematic and the more effort it takes to resolve it. And it very often starts small. But I can tell you, I had one practically overnight that went from nothing, or at least I didn't see it. Whenever she showed it, I evidently didn't see it, but all of a sudden, the first time I saw it, it was huge. But usually they start small, and if you don't attend to it, they tend to get larger. There's no single cause of vaginal prolapses. There is many risk factors. You can see here all the different risk factors. I know my personal experience would suggest that obesity tends to be one of the biggest. The other one, of course, is genetics. It's somewhere between 10 to 15% heritable, which means it's more environmental than it is genetics, but there's still that genetic component that can keep running through your flock. Short tail ducks we associate more with rectal prolapses, but certainly it makes sense that they can have an impact on vaginal as well, because they're weakening things back there. And so some of the risk factors are actually very similar to rectal prolapses as well. But again, I think obesity, overfeeding, in my experience, has been one of the biggest risks. So what do you do with a vaginal prolapse? Well, you got to put it back. It's as simple as that. And you got to do it hygienically. Clean it with warm soapy water. Try to do this as soon as possible so you don't get injuries, so you don't get infections, so you don't get dystocia. If you leave it alone, in some cases they can prolapse, lots of stuff out. So it's just going to get worse. There's lots of different ways to keep it in. One is to use a plastic retainer, which I don't have a picture of. We sometimes call them spoons or bearing retainers. This particular you in the picture is wearing a harness. I think that's from Premier. This is my preferred method, is putting a harness on them. You can make homemade ones, and if you got sheep with wool, you can tie to the fleece. Some people will use both the retainer and the harness. You can also suture it, and again, this would probably be something the vet would do. You can suture it. You must remove that suture, however, for lambing or kidding. Very often, under the advice of a veterinarian, you may also give antibiotics or anti-inflammatories to this animal, and a lot of it depends on the progression. Now, they can lamb with the retainer and with the harness. Obviously, if you see them go into labor, you can probably take it off, but they can lamb with it on. The condition does resolve itself with birthing. But really, you shouldn't keep the female, because she's has a much higher probability of doing it next year. And you shouldn't keep her offspring because of the genetic predisposition. And I would argue that you ought to also think about the genetics that the sire is carrying as well. Most all health problems with sheep and goats we can get rid of if we just get rid of the ones that have it. And a lot of us don't have enough animals to do that. We might not be left with anybody, but the power of culling is tremendous, and it can get rid of a lot of these problems. The next thing I want to talk about is when you talk about health, unfortunately, is abortion. And abortion is when the pregnancy is terminated and the female loses her offspring or gives birth to weak or deformed lambs or kids that die shortly after birth. When they abort early enough, they often reabsorb and may even rebreed if the male is kept in, is still in by the time they're ready to rebreed. Obviously, the later it occurs, they usually have to pass those offspring. Sometimes the female will get sick, and sometimes they will die. Sometimes they are immune after they've aborted for the first time, and they won't do it again. There are many, many causes of infectious and non-infectious abortions. None of this stuff is simple A plus B equals C. There's usually different things that can cause symptoms, and there can be different risk factors. Some of the infectious causes of abortion are also zoonotic, meaning people can get them. They can affect a pregnant woman. They can cause her to miscarry, and they can also have other effects like flu-like symptoms. Most abortions do occur in late pregnancy. So what are the causes of abortion? Well, the three main causes are infectious causes. Chlamydia, we used to call that EAE, or enzootic abortion of ewes. What we used to call vibriosis is Campylobacter, that's the bacteria, and toxoplasmosis which is the one that cats are kind of the host of, because toxoplasmosis is like coccidia in cats. And it's why that women that are pregnant are often told by their doctors not to empty the litter box. Well, by the same token, you need to be careful around ewes or does that are lambing and kidding, because the risk is there as well. As you can see, there's a list of other things perhaps less common that cause abortion. Listeria, we think of that as causing primarily circling disease, but it also can cause abortion. Salmonella. Q fever is becoming, it's a zoonotic disease. It's becoming, I think, perhaps a bigger issue. It's more of I think it causes more like flu-like symptoms in people, but I know the universities are a lot more concerned with it when bringing in research animals. Brucellosis, another zoonotic disease. Leptospirosis. Cache Valley, I don't know. I know Cache Valley certainly, I think it occurs pretty much nationwide. This is an insect-borne one. It causes a lot of deformities, and that's a tough one. It's not. I'm not certain there's too much you can do about it. Nutritional deficiencies certainly can cause a female to abort. I think we don't always know the extent of different nutritional factors in terms of what might cause abortions. Stress, all of a sudden, if a stray dog got loose in your pasture and just started chasing them around for fun, that could cause them to abort. There are certain drugs that will cause them to abort. I think most people understand that valbazen, which is albendazole, one of the white dewormers, is not to be given during the first 45 days of pregnancy. Basically, it can kill the embryos. Most people, because of that risk, don't use it during pregnancy at all. Although no proof, there is a suggestion that levamisole, which is sold as Prohibit or Levamed, might cause abortions to goats in late pregnancy. Personal opinion, I wonder if it's not that combination with stress and handling them in late pregnancy. Not known that levamisole causes any problems in sheep in late pregnancy. Dexamethasone, which we would use to induce labor, obviously would cause an abortion. So if you need to use an anti-inflammatory on a pregnant female, it needs to be Banamine. And somebody just mentioned some glyphosate, which basically Roundup, potentially causing abortions. I think there's things that might cause it that we don't know, and but the vast majority of abortions are going to be caused by those top three. So what do you do if you have what we call an abortion storm? It's really hard to define that because, if you read like fact sheets, they'll say more than 2% of your flock or herd. Well, if you only have 20, it's sometimes the percentages are hard. But when you have a female that aborts, and usually it's not going to be one offspring, it's going to be both of them, is you need to isolate her. Ideally, you'd submit fetal tissues, blood, and placenta to a diagnostic lab to try to get the cause of abortion diagnosed. You want to dispose of all the birthing materials. You want to work with a veterinarian in terms of treating the affected and perhaps more importantly, the remaining females with tetracyclines. Tetracyclines can actually be fed to pregnant ewes. It's the only antibiotic approved use in the feed for sheep. It would have to be extra label for goats, but it can be fed in late pregnancy to help prevent abortions caused by infectious causes like Vibrio and chlamydia. You'd need a veterinary feed directive, but you can do that. You can also give injections, but all of this is extra label, and you need to work with a veterinarian. And obviously, you need to be hygienic because, again, infectious abortion is zoonotic or can be zoonotic, and of particular concern is anybody that's pregnant. So when handling the animals, when handling the materials, you just want to be very hygienic to protect yourself, but also to protect the rest of the females that have not lambed or kidded. Okay, I want to switch gears a little bit, talk about parasites. I don't think I ever talk about sheep and goats without talking about parasites. Well, parasites are very important to the pregnant female. We have what's called the paraparturient egg rise. Paraparturient simply means around the time of parturition, around lambing and kidding, before and after. Mostly a couple of weeks before, up to 8 weeks after. That's kind of the period we're talking about. And what happens to the ewe or doe is that she suffers a temporary reduction in immunity to parasites, both worms, like barber pole worm, and coccidia, around the time of lambing and kidding. There was a research study with katahdins in Arkansas that showed that the katahdin ewes peaked at around 30 days. So that's when their egg counts were the highest. Doesn't always mean that she's sick and needs dewormed, but it means she's carrying that infection. And she's going to deposit those eggs onto pasture, which will become a source of infection for the lambs and kids. In the case of coccidia, she deposits those either on pasture or in the barn, and again, they become the source of infection. The magnitude of that paraparturient egg rise is affected by species, breed, genetics, and season of birthing. But it's a real phenomenon. You know, if you were to ask me who should I be most concerned about in my flock or herd when it comes to parasites, it's the paraparturient female and the weaned lambs and kids. Those are the two that are most susceptible to parasites.
Susan, can we wait for 1 or 2 questions?
I was just looking at, do we have a known LA 200 treatment plan for remaining does in an abortion storm? I'm going to take the easy way out and say that's something that you work with your veterinarian on, but consider that LA 200 only lasts for 48 hours. You know, it's so, you know, I don't know how frequent the injections might be. I know that preferential it would be to feed it, and you could get a veterinary feed directive, but I don't know how many you know, what if there's a known or prescribed plan for that. That would be something you and your veterinarian would have to work with, because some of it would be, you know, the other thing you think about in late pregnancy is you don't want to handle these animals much, and that's why safe feeding it, and in actuality, and it's on another slide, or did I skip it? I think I skipped it.
There's one more question.
Maybe not. Well, I'm still on this one.
Sorry.
but if you talk about abortions, preferential, this slide's going to show up somewhere out of place, but preferentially would be to vaccinate and then to feed an antibiotic, because again, I'm thinking labor and handling the animals and not stressing the animals. And then lastly would be injections, but work with your veterinarian. Okay, next question then. I'm sorry.
What is the #1 cause of urinary calculi in male goats?
The urinary calculi in male goats is it's a nutritional problem, and it's almost always caused by an improper ratio of calcium to phosphorus in the diet. Too much phosphorus, most commonly called by too much grain in the diet. There are some instances where you can get calculi with too much calcium, like you'd never want to feed, you know, your males pure alfalfa hay. But it's primarily, it's the calcium phosphorus ratio. And there's a lot of other contributing factors, like not having them on any forage, them not drinking a lot of water. We'll typically, if we're feeding out wethers or males, we'll typically recommend putting ammonium chloride in the water. For pet goats and pet sheep that are almost always improperly fed, a lot of vets will talk about not castrating them so young, because while it's a nutritional problem and it's easily managed, a lot of people with pet goats don't do that. So they advocate letting that urethra get a little bit bigger, but it's a nutritional problem. Again, imbalance of calcium and phosphorus. So you never want to feed males like pure corn. Corn and oil seeds are high in phosphorus, low in calcium. Soy hulls have a very nice calcium to phosphorus ratio. Legume hays have more calcium, that sort of thing. Okay. But I do have a slide in here for preventing abortions, and hopefully it'll pop up somewhere out of order. So how do you handle the paraparturient egg rise? Well, if we're talking about worms, lamb and kid when the parasites are less active. That's typically winter and fall. Keep the animals off pasture, zero grazing during that paraparturient period. It's pretty easy to do if you're lambing and kidding now. Okay. Increase the level of protein, especially bypass protein. That's protein that bypasses the rumen and gets into the abomasum in late gestation. Feed biowarma. That's a fungus that will help reduce the amount of worm larvae on pasture. I crossed out deworm everybody because we no longer recommend that because of the high level of resistance to the dewormers. We're going to recommend that you selectively deworm using those. And then long-term, bigger picture is to select for resistance in your flock and herd. Okay, so these are kind of somewhat my ideas, some based on research. Selective treatment of paraparturient females, okay? Deworm the ewe if she has bottle jaw, if she has a FOMACHA score 4 or 5, if her body condition score is 2 or less, if she has 3 or more offspring, and if she's a yearling and she's lambing for the first time. If one of those criteria is met, deworm her. On the goat side, because they're more susceptible to parasites, I'm going to change a few things. Obviously, deworm her if she has bottle jaw, but I would treat her if she has a FOMACHA score of a 3, 4, or 5, body condition score of 2 or less, 2 or more offspring, does that kid is yearlings, just like the ewes, and any high-producing dairy doe. So there's no reason to treat the ones that are not under a lot of stress and that are not showing signs of parasitism. The bypass, every single feed out there has, or just about every feed out there has bypass protein. And if you look at a table that gives nutritional requirements or nutritional content, they will say the percent bypass protein. The one that always comes to mind immediately is fish meal. Sounds disgusting or smelly. And it's very expensive, but a lot of the animal sources, which we can't really feed anymore, tend to be high in bypass protein, but even soybean meal has bypass protein in it. But you can look that up in nutritional tables. Okay, how do you manage the paraparturient egg rise when we're talking about coccidia and the oocysts? Got a few more tools with coccidia than we do with parasites when we talk about prevention. Put a coccidiostat in the feed or mineral during the month of pregnancy. These products are not approved for that purpose, so technically it's prescription with your veterinarian. Good sanitation, don't overstock, keep clean, dry bedding on top, clean feed and water. If you're kidding or lambing outside, make sure the pasture is clean and well rested. Avoid those hot spots on pasture. The places where the animals congregate around the feeders or around the shelter. Good nutrition for everybody, not just, for the mom in late pregnancy, the colostrum to the baby, and make sure you control other diseases. Coccidia is worse when they also got pneumonia or E. coli scours or something like that. So manage those other diseases. What about tannin-containing plants for the bypass protein? Well, tannin-containing plants are obviously they're a potential other strategy because though not completely understood, we tend to have less parasite problems when animals are grazing like Sericea lespedeza. And so, yeah, that's another strategy. We can feed it with pellets. We can feed it with hay. We can feed it with silage, and we can graze it. And all of that would be helpful for dealing with parasites, not only in the paraparturient female, but the lambs and kids as well. All right, here's the slide that popped up in the wrong place: preventing abortion. Because nothing takes your profits away more than abortion, and nothing is a greater heartbreak than abortion. The best thing you can do is maintain a closed flock or herd. And here I'm particularly talking about females because it's often necessary to buy a male in so you don't do so much inbreeding. Strict biosecurity, quarantine any new animals, quarantine animals returning from a fair. A good environment, stress-free, or as much as you can make it sanitary and uncrowded. In extreme circumstances, well, I've already mentioned this before, separate first timers from mature females. I would not put the does and ewes that are going to be bred for the first time with the mature females until they get joined for the second time. Always separate the pre and postpartum females. Once a female lambs her kids, it should go into other pens. Manage the pest populations on the farm. I mentioned that toxoplasmosis, cats are the vector for transmission. Doesn't mean you can't have cats, but you need to be a responsible cat owner. Adult cats, spay them, neuter them, and vaccinate them. Most of the toxoplasmosis organism is spread by kittens, so you just need to be responsible. An antibiotic or coccidiostat in the feed. So I already mentioned the tetracyclines can be legally fed under veterinary feed directive to sheep, and you could probably get extra label use for goats to help prevent abortions. And then the coccidiostat in the feed, because toxoplasmosis is cat coccidia, that may help to prevent abortions caused by toxoplasmosis. With the cats, you want to make sure they can't get in the feed, and you just want to make sure you keep things clean and keep things away from the feed. But yeah, somebody made a comment for not studying out your bucks or rams. I couldn't agree more. I mean, there's nothing wrong with working together and sharing genetics, but only if you both trust each other's biosecurity plan. And there is a vaccine for Vibrio and chlamydia. It's given pre-breeding. It's for sheep, so it would require extra label. So to prevent abortions, vaccination is best, antibiotics before lambing and kidding, second best, and having to treat in a storm is the third best. Vaccinating pregnant ewes and does, this is more for the offspring than it is for them, although it never hurts to bolster their immunity to clostridial diseases. But what we're trying to do when we vaccinate in late pregnancy is to maximize the immunity that will be transferred to the colostrum. That's what we're trying to do. We need to do it at least 2 weeks before, up to about 6 weeks before lambing or kidding. If you have animals that you don't know have been vaccinated, you should do them twice, 4 weeks apart. And then the kids and lambs, you start them at 6 to 8 weeks and 10 to 12 weeks of age. Nutrition, again, I know you're going to have a presentation on nutrition a little bit later, but it's not possible to separate nutrition and the health of the pregnant female. 75% of fetal growth occurs during the last trimester. The female is putting nutrients towards milk production. As I mentioned, her rumen capacity is decreasing, especially if she's carrying multiples. I guess you should ask anybody that's ever been pregnant how you feel in late pregnancy. The ewe and doe is less active in foraging and moving towards the feeder. The nutritional requirements increase in late pregnancy because of all these things occurring. This is especially true for energy and especially true for calcium. So the female requires a more nutrient-dense diet, which means better quality forage and or grain supplementation. So the goals, just like the goals of the health program, the goals of the nutritional program, we want to prevent those metabolic diseases, pregnancy, toxemia, and milk fever. We want to make sure we have good quality and quantity of colostrum. We want those moderate birth weights in our healthy, viable offspring, and we want to support milk production throughout lactation. So just some general recommendations, and I'm sure more detailed information will be provided in the other presentation. Test your forages. Know how much your animals are eating. Know how much your animals are wasting. Only by knowing that information will you know what, if anything, to supplement them. Save your best hay for lactation. For example, a very high percentage alfalfa hay is more nutrition than they need, too much calcium. Save it for lactation. Doesn't mean you can't mix it with some of the grass hay, but the pure legume and high percentage legume should be saved for lactation. It's best to feed a mixed, or a good quality grass hay. I've already mentioned separate into production groups for feeding. If you have different breeds of different mature sizes, they should be separated. Don't rely on free choice minerals. Balance the rations for calcium and phosphorus. Don't overfeed grain. What about selenium? We always talk about selenium. It's a trace mineral. It crosses the placenta. So what the female consumes are going to affect the health of the lambs and kids. Any soils containing less than 0.5 parts per million are considered selenium deficient. Supplementation is controlled by law. Vitamin E is also important, but does not cross the placenta. So the source is in the milk. The content of vitamin E in forages is quite variable, but vitamin E is inexpensive to supplement. It doesn't get toxic like selenium. And so the primary symptom of a selenium and vitamin E deficiency is white muscle disease. That's the primary symptom. What mineral block do you recommend for pregnant ewes? I'd rather not feed a mineral block at all. I'd rather give her a balanced ration and know that she's getting the nutrients that she needs. Now, if she's on pasture, obviously I'm not balancing a ration in the same way that I am in hay and grain. So I would not recommend a block, but I would recommend a loose mineral. And there are many, many out there, and you have to look at what is it that you're trying to supplement and make sure that those minerals have what you're looking for. If you look at the map here, this is the map of selenium, and it shows a good bit of Missouri to be adequate in selenium. That the one thing I always remind people is there can be farm to farm variation. And if you look at the map, you see my state is low in selenium. Okay, so the maps give you a general guideline, but you can always find out specifically what your farm is. Okay. Okay. So how do I manage selenium in late gestation? In areas where the soil has adequate selenium, you should be getting sufficient selenium in your forages. A good idea to test your soils. In areas where soils are deficient, you may need to supplement. And it's not just supplementing in late pregnancy, it's a year-round thing. They can't necessarily catch up because you all of a sudden feed it in late pregnancy. It's much better to supplement selenium in the diet than to give it via injections. And it's better to add it to the grain mix and force feed them than to offer it free choice. Again, I understand on pasture, it's going to have to be free choice. Not all mineral products are equal. You have to read the label. And if you want to find out your status for selenium, copper, whatever, do some liver biopsies, animals that die or animals that you have processed. I just had a lamb processed and I asked for his liver, and I'm going to send it off and just kind of get a check on what my situation is, because we can say things in general, but I have experienced copper deficiency in my farm. And so your map says that Missouri is predominantly okay in selenium, but again, what's specifically going on in your farm? Mineral nutrition is much more complicated than obviously than we can talk about in this one presentation, but it's sometimes something that's not looked at sufficiently. So we have to see, well, what is it that we're likely to be deficient in? According to forage tests, I just read this recently, the minerals we're most likely to be deficient in are zinc, iodine, and selenium. So that could be a basis when you start thinking about minerals. Seldom do we need to supplement phosphorus if they're eating much grain. Usually salt and trace minerals is all ones on pasture might need. Okay. Here's just some sample rations. And I think hopefully this is almost the last slide. So a couple of things to remember, the differences between sheep and goats. Remember, goat calcium requirements peak in lactation. They peak in late gestation in sheep. Goats have a higher protein requirement than sheep, and sheep protein requirements peak in late lactation. So a mature ewe, 154 pound carrying twins. Maybe a pretty typical Katahdin ewe. 3 pounds of grass hay, 1 pound of alfalfa hay, and 0.75 pounds of corn. I started with grass hay. What was that lacking? Okay, what we're saying here is, well, it didn't have enough calcium in it. Probably had enough protein because the protein requirements are not real high. And the 0.7 pounds of corn is because that forage didn't have enough energy. So that was a ration. Next ration, 4 pounds of grass hay. This one I made a little bit better grass hay, a little bit higher in calcium. 0.75 pounds of a grain mix that's 75% corn and 25% of protein pellet. And then the last ration is 3 pounds of soy hull pellets and a pound of grass hay. Now, how did I come up with these? Well, I looked at the sheep's nutritional requirements and I kept putting in these ingredients till it met their requirements. I have a spreadsheet that does this. There's obviously other software that can do it, but these rations pretty much met the requirement of mature ewe carrying twins. It met the requirements for protein, energy, phosphorus, and calcium. Switching over to a doe, 132 pounds with twins. She's smaller, so she doesn't need as much, but excuse me, she has a lesser requirement for calcium and a higher requirement for protein. So I gave her 3 pounds of this grass hay and a pound of a complete feed. In the second example, 2.5 pounds of grass hay with a 1/2 pound of alfalfa. I'm not measuring those out. We're saying that's like a 1/6, whatever that percentage is, 15% alfalfa, the rest percent grass. So my other example, 3-to-1, is just, again, one that's about 25% legume. Looking for a ration that might include soy hull pellets. I like to feed a minimum of 1 pound of grass hay, the soy hull pellets, and the corn. I needed to add the DDSG, which are the distiller's grains, to get the higher protein. Okay. Somebody asked the question. Oh, and the one important thing is all of these rations depend on feed analysis. Grass hay is a very generic term. It could be from 40% to 70% TDN, from 5% protein to 20% protein. So you have to actually test these feeds. Same things with the soy hull pellets and the distiller's grains. Anything that can be variable, you have to test. So based on the data I used, these were the rations that I came up with. Essentially, the one you see for the mature ewe over there is the one I feed at my own farm. Okay, just a summary. The last thing is balanced rations. Monitor their intake. Not only feeding them good stuff, but how much are they eating? If you put a round bale out there, you say, well, how the heck can I know? Well, how much does a round bale weigh? How much do they waste? And how long does it take them to eat it? And then you go from there. Always better to hand feed, limit feed hay, than to free choice it. Don't overfeed, don't underfeed. Hygienic conditions, biosecurity, CDT vaccinations, selective deworming, minimize stress, and try to make decisions based on objective data. Don't, you think something's happening, we'll get some data to support that. Test soils, test forages, test livers, whatever. And then let's see what some of the questions are. A bovine nutrition researcher claims calving should be negative. One of the things I'll say about we don't get nearly as sophisticated in nutrition for sheep and goats that we raise for fiber and meat. Dairy goats, we tend, because they're a very highly productive animal, we tend to get a lot more specific, and we tend to, I'm going to say, look to the dairy cow industry a little bit more for guidance. When you say, do we have any targets? No, we don't. We're not, like I said, we're with the fiber and meat animals, we still use TDN, for gosh sakes. That's a very crude measurement of energy. So, for folks with dairy goats, it gets a lot more particular and probably beyond the scope of today's presentation. What do you use for copper in sheep and goats? Well, it's going to depend on, all feed has copper in it, all of it. And some feeds have more copper than others. You theoretically, technically can balance a ration for copper. There is actually software that will get into some very specific minerals. When I had a copper deficiency, I just started mixing beef or cattle and sheep mineral. And I used some of the copper boluses. The copper boluses are actually marketed as copper supplements and not marketed as dewormers. I don't know that we have any specific recommendations on how to use them to, say, treat a copper deficiency in sheep and or goats, but they certainly would be viable for that. You can buy the thing to keep in mind about copper is copper is very complicated, and there's a lot of it depends. There's no recommendations for copper in sheep anymore because it's based on an equation that factors in a coefficient of absorption. Copper oxide, the one that's used for deworming, is a very poorly absorbed form of copper. Copper sulfate, which is an old-time dewormer that used to kill a lot of sheep, is much more absorbed. And then if you buy a mineral product with chelated minerals in it, that's much more absorbed. So it gets to be very complicated. And it also has a lot to do with the antagonists like molybdenum. I think you can blood test for a lot of things, but usually particularly for copper, the liver biopsy is better than blood. Selenium, I don't remember whether blood or biopsy is better, but you can. A lot of these problems you can test the blood. It's just that sometimes the liver is definitely better for copper because that's where it accumulates. And we don't do near enough of testing of soils, forages, and animals, tissues. As for liver, regardless of condemnation, many won't give you if they condemn it. Well, that makes sense if you're just gonna, yeah. But then if your liver is condemned, you might really want to know why. Any more questions? There's 2 more messages. A good ration calculator app. So I think I have a web, if you'll bear with me, I'll see if I think I have a web page article about software for balancing rations. So
Susan, we use that balancing software in January 15th. The one that you are talking about, we use that in January 15th. So a lot of
because there's an online one for goats from Langston University. There's an online one from Montana State University, but it uses the old nutrient requirements. There's spreadsheets, including mine, which is obviously what I use. Iowa State University has some software that you can purchase. Canada has some really sophisticated. I've yet to find an app that would do that. But the one thing I'll say about feeding animals is most people want to feed hay free choice and then supplement a little bit of grain. And if the hay's not real horrible and you don't overfeed the grain, you might get away with that. But when you're wondering if something's wrong or if some things start to happen, that's when you need to dig deeper. Or if you want to save money. I'm giving a talk in another month on how to make money raising sheep and goats, and I know how you make money. And you can't just stick hay out there and ballpark feed them. Since feed costs are 75% of your costs, you got to look at them. You got to make sure you're not overfeeding, and waste are 2 of the biggest costs of raising sheep and goats. So just to point that out. But I know how to make money. So if you ever want to know, you just ask me. Liver flukes. Liver flukes tend to be geographically problematic. I cannot speak for Missouri, but I have never heard of them happening in Maryland. We associate them with the Pacific Northwest, with the Great Lakes states and England and places like that. Symptoms could be very similar to barber pole worm. They get bottle jaw and they get anemic. More than likely, you're going to need a diagnostic vet to help you identify that problem. But your diagnostic labs in Missouri would know if there's a prevalence of them at all in Missouri. They like wet. They need a sterile or slug. And then the other thing to always remember about parasites and diseases in general, I'm not trying to make a political statement, but the climate's changing. And as the climate changes, you could have things that haven't been a problem become a problem, and vice versa. The barber pole worm is moving into new areas because of climate change. Okay, any more questions? Oh, you had okay, then you had livers condemned for liver flukes. Okay, gotcha. So you may not be from Missouri, but liver flukes are like I said, they can definitely be a geographic problem, and I've not really had too much. We're trying to get someone in our parasite consortium to write us a fact sheet on liver flukes. We haven't done that yet, but depending on where you're at. And again, you think of if you get real, wet. One of my colleagues with the Parasite Consortium, and talking to him about lungworms, one of the things he says about lungworms is you may not have them, but you could introduce them, because lungworms aren't a huge problem in this country. But again, things can change. You can introduce things. Some things you introduce, some things you don't. Things change, and you always have to be open to it. But meningeal worm can be a big problem. We have a big problem here, always have. And fortunately, Cornell has developed some good treatment protocols. If you have any questions about those, you can find information on the Worm X website. In fact, I guess, trying to get it to move one more. Oh, there it is. These websites in particular, whoops, it went away. Worm X, anything you want to know about parasites and don't want to know is on that website. So be sure to go there. And questions, anything else? But yeah, you can make money in sheep and goats, but sometimes you got to make hard decisions, and you got to always look at it as a business. And again, that pregnant female, particularly during that last 4 to 6 weeks, that's when you got to be the smartest. That like sets everything up for the whole year. I'm not saying other things aren't important, because they are, but so much that happens in that last while she's pregnant. Yeah, think about people too. We're very concerned when somebody's pregnant, because that's going to have, they're doing more and more with, I just read a really interesting research project. They're doing more and more with the, how does the prenatal, the uterine environment and the nutrition, then how do they affect the viability of the offspring? And their theory is that it can affect parasites by improving the uterine environment. Just so nutrition, I could have gone further back today and talked more about early and mid pregnancy, because they are also important. Maybe that's not when the babies are growing, but you got embryos, and you got the placenta. So they may not need more nutrition necessarily, but it still needs to be right, and you can't have stress, so you got all of those things. But anyhow, I shut up because it's 6.
Yeah.
506. It's 506, 606 in Maryland. But thank you for the opportunity today. And
we have some questions. Don't forget the questions. I will go with the first one. Okay.
did we not get questions already?
Yeah.
Oh, your questions.
No. Well, I mean your questions for the people to answer. So right now there is a questions that the people start answering. So what is the main concern about pregnancy toxemia? So protein, energy, calcium, or selenium? Yeah. So the people is answering now. I will end in very soon. I think right now. And so do you want to share a little bit about these answers, Susan?
Well, 81%. It's energy.
Yeah.
Doesn't mean the others aren't important.
Uh-huh.
It just means that it's a negative energy balance. And and again, the others are important, but the cause is energy. Lack of energy. But it won't help if she doesn't have, that's why I mentioned that we often treat for both calcium and energy at the same time.
Now talking about calcium, requirement calcium, when is used peaks requirements for calcium?
And that question does say you, so if you have a goat,
Okay.
it's different.
Oh, I think right now, well, the people is answering still. So what do you think? Okay. You had the answers there. Late gestation.
Again, the goat's different.
Yeah. So what is the best answer, Sue?
So a sheep's peak requirements is in late gestation.
Okay.
If I'd have said doe, it would have been lactation.
Okay.
A
Good.
lot of times sheep and goats are the same, but it's always important that we talk about where differences may lie.
Okay, I go for the next one. Let me see the third one. Vaginal prolapse. Why is not considered a risk factor? Which is not considered? Okay. You want to comment about this?
It's like most, there's obesity is a risk factor, genetics is a risk factor, and short-tailed ducks are a risk factor. Don't mean to say they're all equal risk factors, but they're all risk factors. And deworming, regular deworming would not be.
Okay. Let me go to the next one and let's one. I think it's this one. Which females should be dewormed around the time of kidding or lambing? Ah, surprise. Okay. I will wait one or two more. Okay. So probably you want to comment now?
Those with FOMACHA scores are one of two. I'm going to say sometimes we get the scale mixed up, and hopefully that's what those 4 folks got the scale mixed up, because 1 or 2 is not anemic. So there's no need to deworm that female. We're trying to get away from deworming all of them. And none of them is potentially an answer, because you'd really like to be there. You'd really like to not deworm them. And under certain circumstances, potentially you could be there. I'm actually there. I don't deworm at that time. But generally speaking, it's these females in poor condition, 2 or less. And in fact, even outside of the paraparturient period, probably body condition is as important as FOMACHA score when making a decision to deworm an adult or adult animal. It's probably just as important. Probably not so much on lambs and kids, but definitely on the adult females is body condition. But again, it's 4 and 5 that are the really anemic. 3, 1 and 2 are good scores. And so anyhow.
We have one more question in the chat box. Are dairy sheep calcium requirements more like goats? Susan?
Well, you got to, there's 3 classes of both kinds of animals, right? Well, actually more. So they did develop sheep nutritional requirements for dairy sheep, parlor milked. Dairy usually means parlor milked, commercial. And then we have parlor milked commercial dairy goats and dairy goats in general. And I'd have to refer to them. My spreadsheet does have a page on dairy sheep, but you would expect you would, and then if we switch to dairy goat, then we got the fiber goats and the meat goats, and then we got the regular non-dairy sheep. So because they're producing milk, without looking at the table, I would expect they would be higher than meat sheep. I could, I'm trying to figure out how to, I'm going to stop sharing and I'm going to look real quick and I'll answer the question specifically. So if I look at an early lactation, 50, so she needs a 176 pound ewe, 0.02, let's see, I'll do twins, 0.0187. Oh, I thought I did. Oh, okay, 0.0. Yes. Yes, significantly higher. And the other thing about nutritional requirements, and they do this probably with goats too, is it's based on how much milk they produce. But yeah, because they're producing more milk, so yes, they're higher. And my spreadsheets have, I don't think I ever finished the the Angora goat one, but I have dairy sheep requirements. And we know, for example, and I don't know if this is true in sheep, but dairy goats in general, because they're a big animal and they're a dairy animal, they need more for maintenance. They need just more feed just for maintenance. Just like an indigenous breed of goat, like a Spanish goat, needs less nutrition than a boar goat, if that makes sense to you. So, and then in the case of sheep, I think dairy sheep are more similar to sheep, but they still need, yeah, they have higher requirements. And then of course it'll be higher if their lactation is higher. Any more questions? But there's a lot of it. There's a lot of good nutritional information on the dairy side on both sheep and goats. And again, I'm going to say it's much more sophisticated than when we're feeding an animal for fiber or meat. It's almost like a different industry. You know, fiber and meat, we talk simple things like TDN and crude protein. We don't talk a lot of those specifics. So it's much more sophisticated, and a lot of work has been done on both. We haven't done near as much work on meat goats as I'd like to say on nutrition.
Okay, Susan, thank you so much. I think we are on time, and some people just are so faithful to you and to the webinar. So we thank you so much. We are going to have our next speaker that will be February 5th. Ms. Jennifer Lutz from Missouri University. She's economics, and she will be talking about the cost of pregnant ewe. And so she has a lot of experience, a lot of information. So also, we want to send an email to every one of you just to ask for the stories that you have learned. So that way that we can just making a compilation of all those stories and also to share with some other people. So thank you so much, Susan, for your time and your experience. You are awesome about your cooperation with us and with everybody.
Okay.
One more thing before I sign off. Somebody says the question was the requirement, calcium requirement higher, like for after, not so much how much, but is it higher like goats after it's higher in lactation? Yes, like goats. Okay, just happened to see that question.
Okay, well, and we need to have another webinar with your camera open. So in the future, we are going to invite you probably by the middle of the year. So thank you so much, Susan.
But you're not allowed to see me on a camera.
Yeah, thank you so much, Susan.
You are
You are
welcome.
always a great source of information.